Tonight, Fijians are more obese than other Pacific Islanders. Speeding drivers on the Garden Island beware. Government pays $1 billion disaster bill, and a woman's pain because of elephantiasis. Good evening, you're watching Fiji Today. Fijians pile on the kilos more than other Pacific Islanders. The obesity problem is so serious that government has challenged all Fijians to do something about it. Permanent Secretary for the Public Service, Pramesh Chan, says our increasing rate of inactivity is causing obesity and shortening lifespans.
A global status report on non-communicable diseases shows that incidences of obesity in Fiji are higher than in other Pacific countries. This is largely because of a greater level of inactivity as Fijians use more machines to replace manual jobs. We walk less and we eat more junk. Pramesh Chan says that we have lost the healthy eating habits of our ancestors.
We need to put in place relevant structures and an enabling environment, and also there needs to be monitoring and evaluation strategies in the overall plan to tackle this growing problem of obesity and NCDs.
We asked people about how we could reduce obesity in Fiji.
The best way to reduce obesity is to control your diet, and more to it is like you have to do regular exercises, as I'm doing every day. I have to have a 30 minutes walk or more.
The first thing which we need to do is to raise awareness about it in the public, and by doing this, people will be able to know what actually obesity is, and then they will be able to implement whatever the health people are trying to do for it. And
around 57% of the country's food, as well as 60% of its protein and 64% of its fat, are imported.
Researchers and government officials met at the Holiday Inn in Suva this morning to find a solution to reverse the trend of obesity in Fiji. The Transnational Research on Obesity Prevention in Communities project is all about addressing the obesity problem with the implementation of proper policies. But such policies need to be based on evidence to be more effective in tackling the country's overweight problem.
Past policies made to address obesity or non-communicable diseases in Fiji have not been effective because Fijians continue to pile on the kilo. Permanent Secretary for the Public Service, Pramesh Chan, opened the embedding evidence base, saying despite having a specific framework for NCD prevention and control, the problem is now reaching epidemic proportions. Health Minister Dr. Neil Sharma says the way forward is putting together policies that are grounded on real data. That is the purpose of the Tropic project that was jointly put up by the Fiji National University and Deakin University to improve the use of evidence in making policies that address obesity. 6 organizations make up Tropic, and they are the Ministry of Health, Ministry of Primary Industries, Ministry of Education, Social Welfare, Women and Poverty Alleviation, Consumer Council and the Fiji Council of Social Services.
There's been a lack of information a lot of times, and that information then needs to be translated into important decision making. We need to have a health policy and planning, a budget unit, so that our planning is such that the services we provide can be improved.
Dr. Sharma highlighted Tropic project is in line with the aim to increase evidence-informed policies making and in building the capacity of the health ministry staffs.
So, it's important. It's a very important aspect. None of the Pacific Island territories have a health policy planning unit, and this health policy planning unit is a end product of projects like Tropic, which has provided my staff with the necessary know-how to be able to research and be able to put those research findings into policy, strategic policy, and then it becomes our business to take that strategic policy and put it into an operational plan.
The Tropic project, which is funded by the Australian government, will be completed in 2012.
Motorists beware on Taveuni because overspeeding will now be strictly monitored. The Fiji Police Force, for the first time, launched its speed detection program on the Garden Island with the handover of a laser speed detector to Island Police.
Overspeeding on Taveuni is a traffic problem that has largely gone unchecked for many years. In the past, it has contributed to a good number of traffic accidents. Police Director Traffic Senior Superintendent Mahesh Mishra says this will change as daily speed monitoring programs is now possible with a laser speed detector. Overspeeding accounts for 70% of the average 300 road accidents recorded in Fiji every year. For about 90% of road accidents that have resulted in death, overspeeding has been identified as a culprit. Recently, the Fiji Police Force spent $100,000 buying traffic enforcement equipments that include 7 laser speed detectors, a dragger alcohol test evidential machine and 9 breathalyzer road testing devices. SSP Mishra says police is investing in such technology to cut down on road accidents and make roads safer for the travelling public. Laser speed detectors will progressively be handed out to all outer police stations around the country, commencing with Tavioni.
Stay with us, $1 billion disaster bill after the break.